Hi, my name is Chloe Meltzer and I'm a Master Public Health student in Health Behavioral Health Promotion. In this video, I'll be presenting my findings of my internship on adult STI prevention education in Nogales, Arizona. I'll discuss where I worked, what I planned on doing, why it's important, and what my findings were and my conclusions. I interned at the Mariposa Community Health Center located in Nogales, Arizona, which is right along the border. I was specifically working in their health and wellness department called Platicamos Salud with case managers who are basically community health workers. My responsibilities were composed of, but not limited to, attending case management meetings, interviewing case managers, and examining existing literature. I would also help my supervisor with general program planning matters. The goals and objectives of my internship were to learn more about the experience of Latinos and Latinas living on the border and to develop/modify an existing STI prevention education curriculum to be culturally tailored to the needs of this population. Currently, the existing curriculum that Mariposa case managers have access to is not culturally relevant. It is very information heavy and not salient to this population. There is a notion of sexual silence in this community and that people are not supposed to discuss sex outside the realm of pregnancy prevention. In addition, Santa Cruz County, which is relatively small and predominantly Hispanic, contributes 81% of all statewide chlamydia cases. Most of these cases are in women. I ended up interviewing 8 people. The key themes of my interviews were that sex is a taboo subject, there are gender norms and expectations, protection only for pregnancy prevention, and personal responsibility when discussing condoms. This is an illustrative quote by a case manager I interviewed. Because, I don't know, they don't like to talk about sex. They want to know about pregnancy, about how to not get pregnant, about the family planning, but they don't want to talk about sex. They're so conservative, you could say that. So they don't like to talk about sex. It's like a taboo, something like that. They think sex is for you don't get pregnant. It's really hard when you want to talk about diseases. They get all shy and say, no, it's not going to happen to me. Nearly all of the staff I talked to said sex is a taboo subject and people do not like talking about it, which increases risk of STI transmission since many of them do not think they're at risk. These quotes are meant to offer context as to why people may not use condoms or talk to their partners. Only one person I interviewed mentioned machismo, but she linked it to the importance of trust, which is important in many Latino cultures. Nearly everyone I talked to said women are more worried about getting pregnant than getting diseases, and it is easier to use pills than talk to a partner about condoms. This also relates back to the notion of sexual silence, that women should not know about sex unless it is about getting pregnant. Because of these gender norms that are meant to prevent discussions of protection, the case managers told me that they try to get the women to think about things differently and discuss the importance of protecting themselves because they do not know what the partner is doing. This is definitely something I used when I developed my curriculum. Based on the interviews and the literature I reviewed, the curriculum should focus on the importance of personal responsibility in terms of preventing STIs in a way that is culturally relevant. For example, discussing keeping oneself healthy so they will be able to take care of their families. I was also told that visuals were incredibly helpful because women will be more likely to read something uncomfortable rather than talk about it. Overall, this was a positive experience. I learned the importance of patience and being flexible, especially with time constraints. I learned about how to tailor messages to fit a specific audience. I also learned about the importance of developing rapport with key staff members. In all, I am proud of this project. Thank you so much again. This experience has been great for me.